Hi there. So this is again another video, or shall I say, a clip about ABG analysis as requested on my Facebook. So I'll be talking about arterial blood gas analysis, or we call this a short ABG. Now remember that ABG, or arterial blood gas, is one of the most important tests in the clinical setup because it is a test that evaluates how efficient oxygenation is. Not only oxygenation, it will also evaluate the current status, health status of the patient with respect to its acid-base balance. Remember, any deviation in the ABG result of the patient has a very remarkable effect in the patient's body. Now, when I say ABG, there are certain values you need to remember. Now, what are these values? You have the pH. Okay, remember the pH test for potential hydrogen or power of hydrogen. Okay, the normal pH in the blood, okay, is about 7.35 to 7.45, correct? Okay, another value you need to remember is your partial oxygen. The normal partial oxygen ranges from 80 to 100 millimeters mercury. Please do not confuse this with your O2 saturation, because your O2 saturation is measured by your pulse oximeter, and that is about 95 to 100%. Okay? Another value you need to remember in your ABG is your partial carbon dioxide pressure. The normal partial carbon dioxide pressure ranges from 35 to 45 millimeters mercury. And last, you have your bicarbonate or your HCO3, which is about 22 to 26 milli equivalent per liter. So these are parameters or values that you need to remember. Let's discuss them one by one first. Let's start with your pH. Now remember, when I say pH or potential hydrogen, okay, there are two systems in the body that will affect or regulate pH. And these two systems are the following. First is what we call your respiratory, sorry about that, your respiratory system. And another system is what we call your urinary system. Okay, I had a chance to ask some students about this, and then they answered metabolic system. Remember, there is no metabolic system. Okay, so these are the two systems to regulate or affect pH. Again, respiratory and urinary. Now, this is the thing you need to remember. If a patient is suffering from respiratory disorders or respiratory imbalances with respect to the pH, your urinary system will compensate. Your urinary system will help. And of course, the other way around. If you have metabolic problem or metabolic disorders, that will of course definitely affect the pH of the body. The system that will help or compensate that metabolic problem is your respiratory. That is why, do not forget, these two systems, they work hand in hand. If one system compensates, if the other system will try to help, you call that as compensated. Can you follow? If the other system didn't do anything about it, okay, did not compensate, did not help, okay, brought about the other system disorder, that is what we call uncompensated. Now, if the help was successful, okay, if the help is successful, you call it as fully compensated. But if not successful, it is partially compensated. Do not forget that. Okay? Now, another. When you have an increase in the pH, you call that as your alkalosis. If there is a decrease in the pH, you call that as your acidosis. In the clinical setup, we don't refer to the doctor, doc, you have a high pH, the patient has a low pH. We don't do that. We only say acidosis or alkalosis. Alright? Now, another thing is, of course, partial oxygen. Remember, an increase in the partial oxygen and an increase in the partial oxygen. If there is an increase in the partial oxygen, you call the condition as your hyperoxemia, right? A decrease in the partial oxygen, you call that as your hypoxemia. Can you follow? Now, another thing is your partial carbon dioxide pressure. The normal partial carbon dioxide is 35 to 45. Remember this. If there is an increase in the partial carbon dioxide pressure, you call the condition as your hypercapnia. Can you follow? A decrease in the partial carbon dioxide pressure, you call that as your hypocapnia. Question. What would be the effect of your carbon dioxide imbalance or alteration with your pH? Do not forget this. If there is an increase in the carbon dioxide level, the pH decreases. Can you follow? If there is a decrease in the partial carbon dioxide level, the pH increases. Therefore, it's safe to say that a patient with hypercapnia will eventually develop acidosis. A patient with hypocapnia will eventually develop alkalosis. Again, hypercapnia, acidosis. Hypocapnia, alkalosis. Are you with me? Okay, very good. Now, another thing. Let me erase this part. Bicarbonate. Remember, bicarbonate, in the very nature of bicarb, it is alkaline. Am I right? So if that is an alkaline, what does it do? What is the relevance? What is the importance? What is the importance? A bicarbonate or alkaline will neutralize acidity. Am I right? Therefore, if bicarb is alkaline and you have too much bicarbonate in the body, what will happen? It increases the pH. Can you follow? Because there's too much bicarb, there's too much alkaline. And it follows that if there is a decrease in your bicarbonate, there will also be a decrease in your pH, resulting to acidosis. Why? Because if there is no bicarbonate, nobody now will neutralize acidity, resulting to acidosis. That is why an increase in the bicarb can cause alkalosis. A decrease in the bicarb will also cause acidosis. Are you with me? So don't forget this. The relationship of PCO2 and pH are opposite. The relationship between bicarb and pH equal. They're the same. If there is an increase in the bicarb, increase pH. A decrease in the bicarb, a decrease in your pH. That is why, okay, let me erase this. That is why some lectures will tell you, or some textbook, okay, you can read this in some textbook, that the mnemonic you need to remember in your ABG is actually your Rome. Remember your Rome? Respiratory, opposite, metabolic, equal. Remember respiratory? PCO2 and pH are opposite. Therefore, it's opposite. Metabolic, equal, because bicarb, pH equal. Am I right? When the bicarb increases, the pH decreases. This is actually in the textbook, but I modified Rome. Instead of saying Rome, I modified this in my book, The Chronicle of Medical Surgical Nursing. Instead of saying Rome, I formulated another mnemonic, and that is what we call your Romeho. Now, what is Romeho? R-O-M-E is still for Rome. No question on this. Respiratory, opposite, metabolic, equal. But I added another concept, and that is your HO. What is HO? Hydrogen opposite. What do you mean by this? It means to say that if you have too much hydrogen in the body, if there's hydrogen retention, hydrogen concentration increases. That is why if there's too much hydrogen, it decreases the pH, resulting to acidosis. And if there is a decrease in your hydrogen, the pH increases, causing alkalosis. Okay, can you follow? Please do not forget this. Romeho. Respiratory opposite, metabolic equal, hydrogen opposite. Okay? So instead of saying Rome, you can add Romeo. Are you with me? Okay, let's proceed. Now, when I say PCO2, bicarb, PO2, and pH, okay, there are things you need to remember about imbalances. Let's start with what we call hyperventilation. Remember, when you hyperventilate, if there is hyperventilation, when you hyperventilate, what will happen? There is release of too much carbon dioxide, right? So hyperventilation can lead to increased carbon dioxide elimination. That is why, if there's too much carbon dioxide released because of hyperventilation, carbon dioxide in the body, of course, decreases. And remember I said, a decrease in carbon dioxide is what we call hypocapnia. And the relationship of carbon dioxide and pH, they are opposite. Therefore, if there is decreased carbon dioxide, it increases the pH. Therefore, hyperventilation can cause respiratory alkalosis. Why did you develop alkalosis? Because when you hyperventilate, there's too much carbon dioxide elimination. Now remember, in your board examination or any qualifying exam, what do you think is the most appropriate nursing action knowing that the patient hyperventilates? Remember, if the patient hyperventilates, there will be a decrease in carbon dioxide. Therefore, your nursing action here is directed in restoring carbon dioxide. So what will you instruct your patient? Very simple. You have to instruct the patient to do what? To instruct the patient to breathe. Okay? Instruct the patient to breathe where? Long time ago, we always answer brown paper bag. Am I right? But we have a new concept now. Okay? Aside from telling the patient to breathe in a paper bag, you can instruct the patient to breathe through his own cupped hands. Can you follow? Cupped hands. Why do we breathe on your cupped hands? The main reason in doing this is actually to restore carbon dioxide. Because when you hyperventilate, there is release of carbon dioxide. Clear? So don't forget this. Hyperventilation can cause respiratory alkalosis. What will you do as a nurse? Tell the patient to breathe in a paper bag or in a cupped hands. For what reason? To restore carbon dioxide. Now, there is a thing you need to remember. What will be the effect in the vascular compartment when there is hypocapnia? Remember, a decrease in carbon dioxide, please do not forget this, a decrease in carbon dioxide will result to peripheral vasoconstriction. What else? If there is peripheral vasoconstriction, that will include the brain. Am I right? The blood vessels in the brain, therefore it causes cerebral vasoconstriction. Now, the blood vessels in the peripheral area will constrict, but the blood vessels in the pulmonary area dilate. In short, hypocapnia can cause peripheral vasoconstriction, but it causes pulmonary vasodilation. Now, why is it very important to know this concept? Because a patient with increased intracranial pressure, do not forget this, a patient with increased ICP, on the first 24 hours, you need to induce hyperventilation. Why is hyperventilation so helpful to patient with increased intracranial pressure? Because we know that when the patient hyperventilates, it causes hypocapnia. And if there is hypocapnia, the blood vessels in the brain will constrict. Therefore, constriction of blood vessels in the brain will decrease blood flow to the brain. A decrease in the blood flow to the brain will decrease intracranial pressure. That is why hyperventilation is so important to patients with increased ICP, okay, lalong-lalo na on the first 24 hours. Can you follow? Please do not forget that. Okay? So take note, hyperventilation is okay on the first 24 hours to patient with increased ICP. Hyperventilation can cause respiratory alkalosis. What about, sir, if the condition is other way around? What if the condition is hypoventilation? What if the condition is different? It's the total opposite. So here, you call it as your hypoventilation. Remember, when the patient hypoventilates, okay, hypoventilation will lead to result to what? Of course, increase carbon dioxide retention. Therefore, if carbon dioxide in the body retains because there is alveolar hypoventilation, tendency carbon dioxide in the body increases. Am I right? Knowing the principle that carbon dioxide and pH are opposite, so what is the effect? Too much carbon dioxide will decrease the pH, resulting to acidosis. That is why patient who hypoventilate develops respiratory acidosis. Why did the patient develop acidosis? Because of carbon dioxide retention. Now, what will be the nursing action? What will you do as a nurse when the patient develops respiratory acidosis and there is what we call hypercapnia? Will you tell the patient to bring in a paper bag or cup hands? No more. Am I right? So what we do here is you instruct the patient to what? You instruct the patient to do, of course, the most famous first lip breathing. Am Am I right? Pursed lip breathing. Now, how do we describe pursed lip breathing? Pursed lip breathing means to say it's just like blowing a candle. When you blow a candle, that's your pursed lip method of breathing, right? Now, how do we describe pursed lip method of breathing? In pursed lip method of breathing, there is longer exhalation than inhalation. Therefore, when you exhale, it has a longer duration. Can you follow? Now, why is this action so important? The main reason, okay, the main reason why the patient pursed lip breathe, okay, whereas there's pursed lip breathing, where the patient pursed lip breathing because of carbon dioxide elimination. So the main reason here is to promote carbon dioxide elimination. So again, hyperventilation can cause respiratory alkalosis. Tell the patient to breathe in a paper bag or cup hands. Hypoventilation, on the other side, patient develops respiratory acidosis. So this time, you tell the patient to do pursed lip method of breathing. Can you follow? Now, knowing that the patient is not breathing well, knowing that there's too much carbon dioxide, will you give oxygen? Of course. Remember, oxygen and carbon dioxide are inversely proportional. Since the patient is not breathing well, it is very important for us to hook the patient in a respiratory support. Can you follow? Okay, so do not forget that. So this is what we call your hypoventilation. What about the other condition? Now, are you familiar with vomiting? Familiar with vomiting? What else? Hyperemesis gravidarum for pregnant. Okay, what else? Frequent gastric suctioning. Now look, when the patient vomits, okay, vomiting. What else? Frequent gastric suctioning. Remember, when the patient vomits, when there's frequent gastric suctioning, you lose gastric content. Am I right? And that thing, the gastric content, it contains hydrochloric acid. That is why when the patient vomits, there will be decreased hydrochloric acid. Can you follow? Because of what we call gastric losses. Therefore, if you lose hydrochloric acid, the effect, okay, the effect of that condition is actually an increase in the pH, resulting to what we call alkalosis. That is why vomiting, gastric suctioning can cause metabolic alkalosis. Are you with me? Okay, do not forget that. So knowing that this condition is brought by vomiting or gastric suctioning, do you think we can give antiemetic here upon doctor's order? Yes, we can. Can you follow? So this is what we call one condition, vomiting. Another condition is what we call diarrhea. Okay, diarrhea. Remember, if there is diarrhea, there is fluid loss. Alright? Therefore, in diarrhea, there is increased fluid loss. Therefore, if you lose fluid, what will happen now to hydrogen concentration? It increases or decreases? Definitely, it increases, right? So remember, if there's too much fluid, okay, fluid that is lost with the patient because of diarrhea, because of what we call hyperactivity of the intestinal area, that will increase hydrogen concentration. Can you follow? The hydrogen becomes concentrated because you lose water. Can you follow? So what will be the effect if there is increased hydrogen concentration? An increase in hydrogen concentration will decrease the pH of the patient. Remember I said Romeo, hydrogen opposite. Remember, increased hydrogen effect in your pH is opposite. Can you follow? So don't forget this. Diarrhea can cause metabolic acidosis. Vomiting, gastric suctioning can cause metabolic alkalosis. Your technique is this. When you vomit, remember when you vomit, the vomitus goes up. Can you follow? When you vomit, the vomitus goes up. The vomitus goes up. The vomitus goes up. The pH goes up. But if you have diarrhea, the diarrhea, okay, the stool goes down. If you have diarrhea, right, the stool goes down. Therefore, if the stool goes down, the pH goes down as well. That's your technique, resulting to acidosis. Clear? Now, you're done with basic concept about hyperventilation, hypoventilation. Okay, vomiting, gastric suctioning, and here comes your diarrhea. Okay, so this time I'll be teaching you how to read ABG in 3 simple steps. Okay, so these are the 3 steps in reading ABG. So what are the 3 steps in reading ABG? The first step, remember I said there are 3 steps. The first step in reading ABG is to check the pH. Simple. Check the pH. Remember, increased pH, alkalosis. Decreased pH, acidosis. No questions on this, right? We know this. Number 2, the second step is to identify, okay? The second step is to identify whether that is respiratory or whether it is metabolic. Can you follow? So after checking the pH, you have to identify whether it is respiratory or if it is metabolic. Now remember, if you suspect that the condition is respiratory, what values you need to assess, you need to evaluate. You check the pH and you check the PCO2. And remember I said, the relationship, this must be opposite. Can you follow? Now, if you think that the problem is metabolic, okay, what will you check? You check the pH and you check bicarbonate. Again, what is the relationship? Equal. Remember? Okay, your mnemonic wrong. Respiratory, opposite. Metabolic, equal. Now, the third step is quite tricky. It's quite difficult, but let me simplify things for you guys. Now, after identifying whether it is respiratory or metabolic, the third step is to categorize. Okay? You need to categorize the problem, whether it is uncompensated, partially compensated, or fully compensated. Now actually I made an algorithm for this so that you can easily follow or track and easily identify what is a specific imbalance. So here it is. Okay, allow me to write the algorithm first. Okay, these are the 3 steps. The third step is, if the pH is abnormal and the PCO2 and bicarb are opposite, that is uncompensated. If the pH is still abnormal, but the PCO2 and bicarb are equal, that is partially compensated. But if the pH is normal, and the PCO2 and bicarb are equal, it's fully compensated. In short, never answer fully compensated if the pH is not normal. That is why we call it fully compensated, because the pH normalizes. Now let me give you an example. pH PCO2, bicarbonate. pH, sorry, you cannot see it. pH, PCO2, bicarbonate. There you go. So let's say that the pH is 7 point. Remember the normal is 7.35 to 7.45. Let's say that the pH is 7.50. The PCO2, the normal, is 35 to 45. Let's say the PCO2, let's say, is 30. Bicarbonate is 22 to 26. 22 to 26, that's the normal bicarb. Let's say that the bicarbonate is 24. Now, let's identify. pH of 7.50, the normal is 7.35 to 7.45. Therefore, this is higher than 7.45. Therefore, increase. Right? PCO2 is 30, the normal is 35 to 45. The result is 30. It's low. Bicarbonate is 24, normal is 22 to 26. It's normal. So with this specific data, how will you rate the ABG? Remember, the first step is to check the pH. Alright? The pH is 7.50 and you know it's increased, it's high. What did it tell you? The pH is high, it's high, acid or alka? It's alkalosis. Therefore, we know it is already alkalosis. Can you follow? So do not answer acidosis. Are you with me? Now, we know that the pH is already alkalosis. Second is to identify what type of alkalosis. Is it respiratory alkalosis or metabolic alkalosis? Now let's cover PCO2. Let's try to check pH and bicarb. Now, if you check pH and bicarb, you suspect metabolic. And if it is metabolic, it must be equal. Are they equal? No. One is high, the other is normal. Therefore, metabolic alkalosis is not possible. It's not possible that this is a metabolic problem. Can you follow? Now let's try to cover bicarbonate. We will check pH and PCO2. Okay, so this is the second clip. So let's go back. If you try to cover bicarbonate, okay, and you check pH and PCO2, it means to say that you suspect respiratory, right? If it is respiratory, the pH and PCO2 must be opposite. Question, are they opposite? Yes, they are. One is high, the other one is low. Therefore, it falls under respiratory. Can you follow? Now, we know that it is already respiratory alkalosis. The question is, what type of respiratory alkalosis? Is it uncompensated, partially compensated, or fully compensated? Let's check. Is the pH abnormal? Yes, the pH is abnormal. Therefore, if the pH is abnormal, you can only choose between uncompensated and partially compensated. Because remember, if it is fully compensated, the pH is normal. Therefore, let us eliminate fully compensated. Now, follow-up question. PCO2 and bicarb, are they equal or opposite? One is low, the other one is normal. In short, they are opposite. Therefore, if the pH is abnormal, PCO2 and bicarb are opposite. What is the category? Uncompensated. Therefore, it is respiratory alkalosis uncompensated. Can you follow? Okay, very good. Now, let's have another problem. Let's have another problem. Let's say this is 7.30. Okay, the PCO2, let's say it's 49. The bicarbonate, let's say it is 28. Let's identify. A pH of 7.30, it is low because the normal is 7.35 to 7.45. The PCO2 is 49 again, it is high. Why? The normal is 35 to 45. Bicarbonate is 20 to 28, it is high. Remember the normal is 22 to 26. Going back to our steps, the first step is to check the pH, right? The pH is low. Therefore, if the pH is low, automatically it is what? Acidosis. Therefore, we know it is already acidosis. Now, identify what type of acidosis. Is it respiratory or metabolic? Let us cover PCO2. Let's check pH and bicarb. Remember, I said, if you check pH and bicarb, Remember, for metabolic, you check pH and bicarb. And these two must be equal. Are they equal? No. One is low, one is high. Therefore, you cannot choose metabolic. Let us cover bicarbonate. Let's check pH and PCO2. If you check pH and PCO2, you suspect respite. And if it is respite, it is opposite. Are they opposite? Yes, they are opposite. One is low, the other one is high. Therefore, this is already respiratory acidosis. Question. Sir, what type of respiratory acidosis? Let us categorize. Is it uncompensated, partially compensated, or fully compensated? Now, is the pH normal or abnormal? Abnormal. Therefore, we cannot choose fully compensated. Correct? So we have to choose now between uncom and fully compensated. The pH is abnormal. Yes. Now, PCO2 and bicarb, are they opposite or equal? Remember, if they are opposite, they fall under uncompensated. But if they are equal, they fall under partially compensated. Are they equal? Yes, they're both high. Therefore, it falls under partially compensated. Remember I said, if the problem is respiratory, the urinary system will compensate. If the problem is metabolic, your respiratory system will compensate. Since this is a form of respiratory problem, the bicarbonate will compensate. What is the compensation of the body? The bicarbonate increases because bicarb is alkaline. And alkaline will neutralize acidity because the patient is acidotic. Therefore, the bicarb increases as a compensatory mechanism to neutralize acidity in the body. But sad to say, even if the bicarb increases, even if the bicarb rises, the pH did not normalize. Therefore, the help was unsuccessful. We label it as partially compensated. But if the pH normalizes, therefore, the help was successful. Therefore, that falls under fully compensated. Clear? Let me give you another example. Let's say that the pH is 7.43. Okay? The PCO2 is, let's say, that the PCO2 is, normal is 35 to 45, let's say it's 47. Okay? The bicarbonate normal is 22 to 26, let's say it's 29. Let's identify. Let me erase this first. 7.43, is it high or low? Answer is normal. Remember, the normal pH is 7.35 to 7.45. It falls under this range, therefore it's normal. But remember, there is a technique. Okay, there is a technique. Hold on, can you read this one? Sorry. 7.35 to 7.45. This is normal pH, right? Now, we know that this is the normal pH, but remember there is a technique. The mean between 7.35 and 7.45 is 7.40. So you need to follow, this will be your guide. Okay? Now, 7.40. Is 7.40 now is your guide? Yes, it is. Going back to the result. The result is 7.43. Is 7.33 higher or lower than 7.40? Answer, higher. Therefore, we know it's normal, but it is higher than 7.40. Remember I said, if it is increased, that is what we call alkalosis. Can you follow? But we know it's normal within the range. It's normal, but it is higher than the mean, which is 7.40. Now let's go back. Scale 47, what is this? High or low? High. Remember, normal is 35 to 45. Bicarbonate is 29, normal is 20 to 26. It is high. Let us cover now bicarbonate. Let's check pH and PCO2. Again, pH, PCO2, suspect respite. If it is respite, opposite. Are they opposite? No, they're both high. Can you follow? One is higher than 7.40, but it is even in the lower range. Okay, so it's not possible to say respiratory problem. Cover PCO2, check bicarbonate. Bicarb is high, pH is high. If you check pH and bicarb, you suspect metabolic. is metabolic, they must be equal. Are they equal? Yes, they're both high. Can you follow? Therefore, it is now what we call metabolic alkalosis. But under what category? Alcohol, partially, fully. Question. Is the pH normal or abnormal? Answer, the pH is normal, right? It is within the range. Therefore, if the pH is normal, what is that? Fully compensated. Therefore, this is metabolic alkalosis, fully compensated. Can you follow? So please do not forget this. All you have to do is just to follow the 3 steps. The first step is to check the pH. Second is to identify whether it's respiratory or metabolic. And the other one is to categorize whether it is uncommon, partially, or fully. Now, in an advanced ABG analysis, there are times when we encounter mixed acid-base imbalance. But it is on the higher level of ABG discussion. Okay, just to give you a glimpse on this. Example, pH, decrease, PCO2, and your white part. Increase, decrease. Remember, respiratory opposite, respiratory category. Metabolic equal, under metabolic category. They fall under wrong, respiratory opposite, metabolic equal. So with this result, what do you think is the reading? The reading here will be mixed metabolic acidosis. Can you follow? The patient is both respiratory acidotic and metabolic acidotic. So this is an advanced type of ABG analysis. So if you have mixed respiratory acidosis, respiratory metabolic acidosis, there is also mixed respiratory metabolic alkalosis. Can you follow? So to this mixed respiratory metabolic alkalosis, okay, it will be increased pH, decreased PCO2, and of course, increased in your bicarbonate. So this is your mixed respiratory metabolic